So let's discuss or let's look at the ketoconazole. Honestly, I'll not be having a lot of words for this ketoconazole. Reasons not. Okay, let me just say the truth. I don't love even dispensing this drug because its level of effectiveness to me is compromised. So it's not my best dish for my patients. So, but anyway, I have to speak about it. First of all, ketoconazole, it is, as we said, it's a fungistatic in low doses. Inhibits the fungal replication and multiplication. But in high doses, it's fungicidal. It's going to kill, denature, deplete officially the fungus. Why sometimes is the reason why it is toxic, and it can even cause some serious side effects with the users. But again, ketoconazole works best in an acidic medium. Yeah, so acidic gastric environment. So what is for us to note? When you're using ketoconazole, kindly restrain yourself from using proton pump inhibitors, H2 blockers, antacids, and all this. Because when you take PPIs like esomeprazole, you are going to block the acid from getting the gastric environment. And also, when you take antacids, you are going to neutralize the acidity. And then you are compromising the effectiveness of ketoconazole. So, less acidity, we are going to have less absorption, or even nil absorption. Then we are going to fail. We are not going to get results for the fungus. So ketoconazole, it comes in two formulations. Rather, we have the ketoconazole cream. The examples like the heterol cream, Kazole, all those creams. Yeah. And then we have also the tablets, ketoconazole tablets. Yeah. When you are using a tablet of ketoconazole, you can potentiate with products like salicylic acid, which is an ointment, because it works best. Limited to dermatophytes. This only the superficial hair, dead skin, and nails, which this one does very well. And I cannot advise you to use ketoconazole equally that is used for this, because it has very little effectiveness to this. There's the case of candida. Yeah, you see, we have candida, like albicans, candida. We have yeast, and again we have internal mucosa fungal infections. This where we best employ ketoconazole, because it can easily thrive and work to eliminate these candida, yeast, and fungus in the mucus, the mucosal linings. That's the short story of this. Soft tissues and joint body fluids. I think that's what I can say about ketoconazole, unless and otherwise I get questions in the comment section. So full videos in the YouTube and shorts of them in Facebook and the other forums. So please feel free to challenge us or other ask us questions on what to do when you have such problems. So a quick one, what I've observed for the two. If you have tinea pedis, arthritis feet, please run and use ketoconazole. If you have nail fungus issues, please use ketoconazole. If you have jock itch or what we call tinea cruris, please use ketoconazole. Because I can tell you, if you use ketoconazole, you will not be achieving a higher percentage of healing. You will be targeting the 3%. But for this one, 70% of course. And to use other antifungal creams and ointments, we have things like Extradam, Beclomin, and Mycomin. Because sometimes when you have persistency in fungus, they can result into some bacterial infections. That's why we use a combined cream to eliminate all that. I don't think I've forgotten anything to say about these two. And of course, ketoconazole and ketoconazole, most of these we use them once daily. They're taken OD once daily because of what they can cause if they are taken in high frequency or maybe regimens that are 2 to 3 in a day. We stick to taking them once a day. So take this when you are full with a fatty meal like beef, which is wet. You can even take dry, but wet beef is the best that he has resolved to give us the best results. Whole milk and all that, even yogurt. But for this, please take it on an empty stomach. When you have acidity, medium is highest. And of course, when you're taking this, don't take antacids, all those ulcer drugs. Thank you very much. Keep following us.